And ladies and gentlemen, today we dive into two of the most daunting topics for the nurse practitioner students facing the boards, non-clinical and pediatrics. And we will start with a matching game. So I want everybody's hands on the keyboard if you're at home on that piece of paper, because I will post a question or something in front of you and you will choose the right answer. So next one, prioritizing patient care with equal fairness. Is this justice, utilitarianism, dignity, or veracity? What do you think? I want everybody participating. Please remember, we don't care if you're right or wrong. We just want you to practice, and this is for you. All right, we'll reveal the answer in 3, 2, 1. And the correct answer is justice. Nice job in the chat room. Now, justice means fairness. Nurses must be fair, period, when they distribute care. For example, among patients with a group of patients that they are taking care of. Care must be fair. Care must be justly and equally distributed among other groups of patients, right? We just got it. Fairness is justice. Very good. How did you do? Go ahead and share in the chat room. How many did you get correct? Was it hard? Was it easy? This is the only way that we can get you to understand each term is by putting them into context and defining the terms. So how did you do? Our first actual question. Which of the following best describes the purpose of the ANA Code of Ethics for Nurses? Is it A, to provide guidance on legal issues in nursing practice? B, to provide a framework for ethical nursing practice? Is it C, to promote nursing as a profession? Or D, to establish standards for nursing education? Okay, I see a lot of B's coming through. Let's reveal the answer. You're all correct, to provide a framework for ethical nursing practice. And please feel free to read the rationale, and you can do this later when you watch the video. But let's move on, because we have some serious terms we need to talk about. Ombudsman, guardian ad litem, living will, and all these other terms you have to be familiar with before you enter the exam and be able to apply them when they give you an example. So let me describe one of them and you tell me which term is the one that I am talking about. Ready? So in the chat room, for the people in the class or in the piece of paper, which term do you think I'm describing when I discuss or when I mention that this is a written legal document that spells out medical treatments you would and would not want to be used to keep you alive, as well as your preferences for other medical decisions such as pain management or organ donation. This is an example of, all right, in the chat room, I see people putting in living will, advanced directives. Very good, very good. And the correct answer is healthcare. Okay, so I see I see some mixed answers, and that's absolutely okay, but this is a living will. A, B, C, D, you have to know which one is what. And if you think that part A is hospital coverage, it's like the most important. B is medical coverage. Part C is what we call the Medicare Advantage. And D is easy. It's for drugs, for prescription drugs, okay? But make sure you clearly understand this stuff. But let me quiz you. Let me quiz you. All right? You'll tell me if it's part A, B, or C, because technically part C is A and B combined together. That's all C is. So you have to remember, D is too easy to even study. D is drugs. C is A and B put together. So all you really have to know is A and B. All right. Which part is walk-in clinics, urgent care, emergency room, lab workup, EKGs, CAT scans, durable medical equipment, second opinions, dialysis, ambulance? That's your B. Very good. All right, let's play a game. It's a matching game. On the left side, you have the culture, and on the right side, I will expose the belief. And as I expose them, I want you to tell me which culture you think it applies to, because yes, you have to know cultural awareness for the nurse practitioner boards. Are we ready? All right, hands on the keyboard at home on a piece of paper. The first one is, may view illness as punishment. Healing is done by shamans using prayer, dance, fasting, and hallucinogenic plants. Do you think it's African Americans, Latino Hispanics, Native Americans, Asians, or Jews? Okay, I see a lot of people agreeing that it's Native Americans. And you're all correct. It is Native Americans. Very good. Next one. These are Orthodox who prefer clinicians of the same gender. Male hadisic, oh boy, I give it away. Jews may decline to shake a female's client's hand. Kosher diet. So, I should have made it harder. But yes, of course it's Jews. The answer gives it away. Next. Many follow Christianity, hold pastors and preachers in high regards. Church can provide emotional comfort. Who do you think this applies to? Very, very good. It is your African Americans. Very good. Next one. Listening without questioning is a sign of respect. Hold elders in high esteem and value their opinion. Who do you think these people? Exactly. These are your Asians. Very, very good. And last but not least, mother may play an important role in healthcare, multi-generational households. Some believe in folk healing. And the only one that's left is your Latinos. Very, very good. On the exam, take advantage of process of elimination. The ANCC may have a question like this: select all that apply, drag and drop or match, just like I showed you here. All right, let's move on to pediatrics. Our first question: at what age do children typically start to grasp objects, reach for toys, bring them to their mouth, transfer objects between hands, sit up, and roll over? Is it A, 6 months, B, 10 months, C, 12 months, or D, 18 months? And I can't stress the importance of you reviewing this material. You see the Cohen Review green highlighted, right? That's what I call the Cohen Review green. It's because that's exactly how you may see it on the exam, how they explain it. So you got to know these are the giveaways that you got to remember these terms exactly word by word. And yes, it is 6 months. I have a beautiful chart here so that you can review, but it tells you exactly what happens at each month. And pay attention to the Cohen Review green. Out of all the terminology you see there, the Cohen Review green is what you have to put on that note card when you're studying, because that's how you may see it on the exam. This is another game that I have for you, and I want you to name the rash. So you see the picture here, and I want everybody in the chat room to tell me, what is this? But this particular rash you see in front of you is benign. It is a congenital birthmark. It presents with this blue, green to black colored patches or stains, usually found on the lumbosacral area of infants and most commonly African or Asian ethnicities. But it usually fades by the age of 2 or 3 years old. Let me tell you a little bit more. This should not be confused with abuse, like hitting, that the parents abuse the child. What are these? Okay, I see some answers coming through. Mongolian spots seems to be the answer that you all think it is, and you are correct. So this is a very good practice for the ANCC exam, because they may show you this and say, what is this? Or they may describe it. This is for the AANP, the way I did, and you need to know that this is your Mongolian spots. Let's go to the next one. This rash, it's a skin rash caused by trapped sweat under the skin. It presents with multiple 1 to 2 millimeter papules. Remember, papules pop. Mostly on the forehead, cheeks, and nose, is self-limited, and it resolves spontaneously. What is this known as? And it could have multiple names, so don't be afraid to type in something differently from what you see everybody else typing in. But Claudia, Kadiatu, thank you for participating. Where are the rest of you? I need to see more answers coming through. Agatha, okay, all right. So it may be an easy one, because you all know that this is your milia or miliaria or your prickly heat. All right, next one.
If you found my teaching style helpful, I welcome you to check out my website, thecohenreview.com. See the link in the comments below. The Cohen Review offers lectures covering all systems: cardiac, GI, psych, derm, focusing on the most relevant material to help you pass the nurse practitioner board's exams. Unlike some of my competitors, we will not overwhelm you with unnecessary material. We offer a growing Q bank, live webinars, and private coaching. Oh, and did I mention our free blogs? To visit these, go to thecohenreview.com/blog. I am here to support you into becoming a certified nurse practitioner. So please, do yourself a favor, click on the link below, and let's embark on this journey together.